One of the areas that Dr. Agha specializes in are thigh lift and thigh-plasty procedures. Not many plastic surgeons do perform procedures of the thigh because they are very complex and comprehensive procedures. So the placement of those incisions and the way that the thigh is elevated and lifted and how the anchoring sutures are performed is a very intricate procedure. Dr. Agha performs many different thigh lift procedures because we have different planes of our thigh, so front, inner, outer, back, and he also performs a vertical thigh-plasty. So different thigh procedures address different aesthetic issues that patients have. So it's very important to identify what is bothersome to the patient. What thigh procedure they're looking for is dependent on the area that's most bothersome to them. So for example, a thigh lift procedure, Dr. Agha will perform to address laxity and excess skin within the thighs on the different planes. Dr. Agha has created and trademarked his spiral thigh lift procedure, which is a thigh lift to address the inner and back of the thigh. Typically, thigh lifts address laxity and excess tissue located on the thigh to lift and elevate, and those incisions are created around the groin and underneath the buttock area. A thigh-plasty can also be performed where an incision is created from the inside of the knee up toward the groin area to reduce the circumference of the thigh, which we refer to as a thigh reduction, as opposed to a thigh lift.